Good afternoon, good morning, or good evening, wherever you may be. My name is Ann Brazo. I'm the founder and CEO of MPN Advocacy and Education International. Happy Valentine's Day. And because it's Valentine's Day, we decided to bring Justin Grinnell, who has been our exercise and helpful guru over the last couple of years, helping our MPN patients with blood flow exercises and moderate to medium exercise programs. And so we thought it would be apropos to have him here today on Valentine's Day to talk about cardio health. And so he will be with us for a half hour. However, if you have questions, please send those through the chat. And I will try to ask him those questions at the end of this session, or he can respond to them as well after the session. So thank you for joining us today, and I hope you benefit greatly from this webinar. I'll be back when we are over.
All right. Well, thank you, Ann. Looks like I will get rolling here. Thank you so much for joining me today. Appreciate it, Ann. Always have me tag along and talk about the fitness part and how it can help you MPN patients. And, the more and more I research, the more and more I read, it's just so beneficial to at least start somewhere to move. And that's what we'll talk about today. And we'll talk about, where should I start? Where should I go? And I'm going to give you some markers to look at. And so that you have a better idea of what you should be doing and how you should start. So let me go ahead and get my screen shared here for you guys. So we have a little slideshow here for you. Okay. All right. And like Ann said, you guys can ask any questions, and I can even stay after a little bit. And I always do this too. I'll let you know that my email is justin@mystateoffitness.com. And if there's a question that comes up later on in the day, or maybe you just don't want to ask it at this time, you can feel free to email me and I'll get back to you. So as you see the title here, Heart Healthy Fitness, creating daily intentional movement habits to help build a more resilient body, healthy mind, and unlock your full potential. I like to think of exercise as filling a bucket that's going to make everything else better. When you're feeling better, when everything's moving better, you can do everything else better. It's just that simple. But with the special considerations with MPN patients, we've got to take steps. We've got to look at where we're at, make sure you're talking with the medical professional that you're working with. But by working with some clients now, in particular on some Zoom sessions, I'm starting to see, what people can do and not do. And everybody's starting at a different point. So I hope I can give you some things to think about, with your own fitness journey here. Okay. So let's go ahead and get going here. There we go. Now it's moving. So what does fitness mean to you? Well, I bring that up because it means something a little bit different for everybody. Because some people are really hardcore at it. Some people love to lift weights. Some people, think of fitness as just walking. So whatever fitness really means to you, that's what it means. And it's not all, I'll talk about this later. It's not just black and white. You don't have to do X, Y, Z just because someone said to do X, Y, Z. You really have to take fitness as, okay, we've got this philosophy, we've got these approaches, but how am I going to intertwine it into my daily life? And how can I make it work for me for the intensity level that I can go at? And I use this term here. It's not your fault, but it's your responsibility. What I mean by that is, try to take accountability for what you think you can and cannot do, but seek a medical professional, seek a trainer, seek out somebody that can help you. Because even myself, after being a trainer for 22 years, for doing fitness forever, I still need help. I still need someone to help me out and guide me, because I can get in my own head and think I can do this and do that. And let me tell you, I've done that before many times, and you push the envelope and you get hurt. So make sure you're kind of doing this properly, making sure you're starting out and building up. And I put this out here because you have a picture of people, you got a picture of gold, and we think of assets in life, and gold is a monetary asset, right? And we hold that, very important, and it is. But the more important thing is our people, and people are your own self in particular. You're your biggest investment, your biggest asset. And so I say this because it can get, for you guys that have a blood cancer, it can get hard. You're tired, you're not feeling that good. Maybe something else is going on. You're like, man, I can't exercise. I don't want to do this. And that's a normal feeling. I still feel that myself, but continually trying to find out what you can do, seeking answers, just really never giving up. And when times get tough, saying, you know what, I'm my biggest investment. I need to make sure I try to figure this out. And so whether it's time, money, effort, it's worth it. Any time, money, effort that you put into it, you may, trip and fall and not feel like you're getting success in exercise, but I can tell you anything that you do as far as movement's concerned is going to be great. Okay. Because you could think about an hour workout, say it's a great hour workout, like, people will say they need to do. Yeah, it's like putting maybe $100 in the bank account. It's a great time. It's a great effort. But even these micro breaks, what I talk about, that's like putting these like $1, $2, $5 deposits in your bank account. And over time, it adds up. So don't think you have to do a lot at once. It can be these short, small bursts, 2 minutes, 4 minutes, something like that, at any given time. And you do maybe a few times throughout the day. Well, it starts to add up to that $100. So, it doesn't have to be all the time or in one shot. It can always be something small built up over time. And that's kind of your fitness investment strategy. Small, frequent deposits done every single day for the rest of your life. And it can be, again, as little as just, right now, if I get up and I walk around the block, that's tough for me. Well, okay, that's all right. That's your capacity right there. And that's what you're going to work towards. And maybe you can get a few more steps, the next day, and so on and so forth. And the same thing applies to strength training and yoga and all the other stuff. Just kind of think of the fitness bucket as anything with movement. And we're going to focus more on cardiovascular today. And I always put, some take a picture of our gym with a lot of people. And even though they probably just went through a hard workout here outside, they're all smiling. And the reason they're smiling is because, you elicit these great things in your brain when you work out, especially with other people. And so if you can find a support group, find a trainer, find people that you can work out with, you will see that you'll have much more success. You'll have a lot more fun doing it. Whether it's a walking partner, whether it's someone that, you can train with through Zoom or in person, or whoever it is, your kids, it's going to be a lot better. Okay. And they always like to say, we got through some of the pain together, so now we're smiling together. So what do we do next here? So I mentioned this earlier, fitness is not black and white. What I mean by that is you don't have to go hard or, all the time. You don't have to do, exactly what, say, an article in the New York Times says or whatever, like, oh, I've got to do that. They said that helps increase longevity. Well, maybe, but maybe that's not right for you. Don't make it a burden. You've got to figure out a way that you can look forward to it. And maybe not every day, because sometimes some days are better than others, but, looking at it as, man, I'm going to fill this fitness bucket and it's going to help everything else in my life. I may not be able to go as hard as I want. Maybe I couldn't do what I did in high school or whatever you're thinking, but that's okay. It has to be about living. You're doing this for life, just like drinking water or anything else that you do. So I'm going to give you this kind of general description of maybe, what do we need to do? What does our body need? And in general, whether you are younger, older, have some type of physical ailment, fit, not fit, kind of all need the same stuff, but we need it in different capacities, different intensity levels. And 3 workouts a week, if you can just get that in at a minimum. And again, a workout can mean something different for everybody. Just make that your goal. I know I said the daily deposits. Well, maybe that's too much for you right now, or maybe you have the bandwidth to do it. That's okay. You go down below and get these micro movement breaks. All right, micro movement breaks. And whether you have, a blood cancer or you don't, this is great for everybody because we get static. We start to stay in the same spot. We start to, maybe sit more. You're really tired. It can be as simple as just getting up, going up a flight of stairs, coming back down. And that will, over time, revive you. Your body thrives on movement. And I say you're working at an office or wherever you work, and maybe you're doing a lot of computer work or whatever. The best thing you can do is just get up, do something physical, and then come back. And it could be a yoga pose. It could be a plank. It could be, walk around the block. Again, that's where I think the goal is. If you can continually do those throughout the day, that's really going to help. And that helps everything else because you get more mobility. If we get static, things tighten up and we're not able to move as well. And then maybe joints hurt, muscles hurt, what have you. And so that's where that mobility comes from, are those micro breaks. And we're not going to talk a lot about strength training today, but we know it's important for building muscle tissue. We want to retain that, building bone, better blood flow. I talked a lot about blood flow with MPN patients, making that move more efficiently. We're going to focus on the cardiovascular stuff here. But if you can do other things like active play, preferably outdoors in the sun is huge. And again, that can mean it's just maybe it's throwing a ball around with your grandkid or kid or whatever. Those things are huge. We don't talk about those enough in fitness because we think about, okay, go to the gym, do this, do that, which of course is needed. But trying to get outdoors, doing something active, it can be very remedial, very small. That's also big time bucket filler. So again, just kind of reviewing a couple things. Move well, move often. Okay, micro movement breaks. Self-massage is something I want to point out too. So many of you probably have maybe or have one, a foam roller. Maybe you have a massage ball. That's really good because it's not going to do what a massage therapist can do, but you have the fascia tissue that encases the muscles. Okay, think of it kind of holds the muscles together. Doesn't necessarily exactly do that, but kind of think of it that way. And it gets bound up, it gets tight. You get restriction of blood flow, get restriction of fluid movement. And all that really does, it tells that tissue to relax. It tells your brain actually to have it relax. And it helps, the more movement of fluid in the body. And that's a great thing to do before you work out because you'll move a little bit better. Same with the hot and cold therapies. A lot of great evidence about how it has a variety of great things that you can get from that, whether it's going to be recovery, reduce inflammation, which is going to be huge, especially with the MPN. And so that's something that I wanted to touch on real quick. But the zone 2 cardio is where the money's at. What I want you thinking about that as is I would talk about the talk test. We'll also give you an equation to figure out heart rate. I think it's important to have a heart rate monitor of some capacity because it shows a lot of different markers, and we're going to dive into that here pretty quickly. It's an intensity where you can, you're going, you're moving, you're working, but your heart rate's up, you're breathing harder, but you could have somewhat of a conversation with somebody. So you could, maybe it's your walking partner and you're going to say 2-3 sentences, but then you got to take a little break, regather your breath and then go again. That's where you get a really good eccentric and concentric contraction of the heart. And that's going to help better stroke volume, like efficiency of the blood flow going through the body. It's going to help increase your cardiovascular health, increase what's called mitochondrial output, meaning your body, you guys probably remember from maybe biology class back in the day, or if you have a science degree, that's like the powerhouse cell. And I could go on and on and on about that area. But we also want to think about the VO2 max. That's a huge longevity marker because it's something you build up over time. You can't really get it and say, okay, I'm going to get in shape in 8 weeks. Well, you can improve it, but it's more of a long-term thing. Okay. And it's kind of built up with the course of time with your fitness. To train, you can get it through accumulation, meaning over time, zone 2 cardio, lower intensity things. But to really get it up there, you do have to do short bursts of something that you would figure for yourself intense. It doesn't be very long. Okay, it doesn't be very long, but it's something that I'm working with a patient right now, and we got about 10 seconds, maybe 15 seconds of that type of hard work, but then we got to take a long break. Okay, long break. So it can be challenging for some folks, but typically we can get somebody to an area where they can do it for a little bit longer, 10, 15, 20 seconds. Just that challenge for that period of time, but then you've got to take a good break to recover. And again, I mentioned the active play outside. All right. So let's talk about, should we get high or low intensity exercise when cardiovascular fitness is concerned? And, over the past, let's call it 10, 12 years, it's a big uproar of HIIT training, high intensity interval training, boot camp style workouts, real intense kind of interval circuit type training. Great stuff. It's got a lot of great stuff. I don't want to throw too many stats out here and bore you to death, but like acute strenuous exercise can increase platelet activation. And, as MPN, we're not looking to do necessarily all that because the big thing is because the recovery, all right? The recovery is just as important as the intensity or the amount of exercise. So for example, let's take a simple example. You take a dumbbell and you put it in your hand, you do a bunch of bicep curls. All right. And say you do a bunch of them, like you just really go for it. Right? And all of a sudden you're like, oh my gosh, I can't even like extend my arm the next day. It's just too strenuous. It was too much for your body. You have to look for those indicators in exercise where, yeah, a little soreness is good. And sometimes it's needed to rebuild tissue, or maybe you really push the cardio and man, my lungs are burning. But if you're going in intensity, you can't recuperate, or within that period of time that you're exercising, or when you're at the next day, soreness and things like that, that just means it's too much. And we're talking about some heart rate markers that you can look at, that where you can see, how much you recovered. And I want you to think about this as far as your resting heart rate, and when you get it up to a certain level, how fast can it come down? All right, so those are some things we can do to monitor the stress. When we think about 90% max heart rate contraindications, think about that zone 2. We want the heart to kind of pump blood, like the best way I can describe it is it kind of flows real well. It's it fills up and then it pushes out in a nice methodical manner. When we get it like 90% plus, we're going really, really hard and high, our heart actually kind of flutters. Now, that could be necessary, for example, my 5th and 7th grade basketball teams, young guys, we need to get up there because they're going to do that in the game a lot, but they can recover much faster, right? And I mention this because a lot of people think, oh, the heart hit training, I've got to go really hard, and that's going to be more bang for my buck. Well, it depends. Maybe not for you. I don't think as you get over the age of 40 or 50, or have some type of special considerations like blood cancer, maybe blood pressure, that you need to really live in that 90% max zone much, if at all. So keep that in mind. But we know that regular physical activity is great for us. And we talk about the zone 2 cardio, helps the efficiency of the heart and blood flow, improves the mitochondrial function. And just think of that, that term is, all right, it's going to get my cells a little more healthy, a little more efficient, a little more powerful, okay, a little stronger. All right. And let's go to this one right here. I want to talk about this. And this means something different for everybody because, again, think about the intensity. If you're getting your heart rate up high, all right, and it's physically demanding for you, you don't need a lot, but there's something called lactates that's produced, okay? And I don't necessarily have to read this whole thing for you, but I wanted to put it on here. There's a lot of words for a slide for me, but I wanted you to be able to read it. And what it comes down to is when you are able to do exercise, and again, strenuous for you, you get this good dose of lactate into the brain, and it does this cool thing called the release of the levels of brain-derived neurotropic factor. Okay, and you're like, well, I'm talking about the heart today. Why not? Why the brain? Well, the gut, the heart, the brain are so connected. All right, and the heart intensity is going to drive this BDNF, and so that's the way I want you to think about it. And we know how important the brain is. Okay. And I'm going to turn this, and if it's too fast, guys, I can send this to you, okay? If I can get the page to turn here for some reason. And what happens is you get this nice elixir that's going to help be neuroprotective. It's going to help improve your mood. So, it's tough going through a disease. You're not feeling really up. This good dose of lactate can improve your mood, decrease depression, all types of cool stuff. So, think about exercise as fueling the brain, so it fuels the heart as well. As I mentioned, cognitive function, it's neuroprotective, and they're really doing some great studies with that. And then we mentioned the mental health benefits. Now, I mentioned this because to even do exercise, you got to feel good. You've got to feel good. If you're feeling bad, you may not want to be motivated to exercise. So if you kind of continue to get these micro breaks, get your heart rate up above your resting heart rate to some type of level, you're going to get some of this stuff to the brain. So it's going to give you a little more motivation, a little more inspiration to actually get out there and get after it. All right, so these are some big ticket things I want you guys to think about. These are the things I want you to write down. These are the things I recommend because you can track these with a lot of these wearable devices. And these markers can really guide you to how intense you should exercise, how healthy or how fit your heart is. So the first one is going to be your resting heart rate. All right. So a goal for most of us should be 65 beats per minute or lower. Now, there's going to be a variety of factors that can affect this, from stress to maybe a medication you're on and so forth. So the bigger thing, even though I gave you this 65 beats a minute, yeah, we'd love for you to be in the 40s. But what I more want you to focus on is, am I improving it for myself? So you may be in the 70s or 80s. And what you want to do as you go with your exercise and improving your cardiovascular health is my resting heart rate getting better? This is also a good indicator that I'll give you an example. A few weeks ago, I wasn't feeling very good, and I looked at my resting heart rate. I'm like, wow, it's really high. Why is it so high? It went three days in a row, and what do you know? I got sick. For your patients, this is a great indicator of how well am I recovered? How well am I feeling today? Maybe it isn't a day I want to work out today. Maybe it's really high. It's a good marker of just how your body's recovering and feeling. And so it just gives you an idea of how intense I should go. So if your resting heart rate's really high that day, maybe you should take it a little more easy. If it's a little bit better, then hey, maybe I can push it a little bit. So it's a great guide, a great marker. The next one is your heart rate variability. And what a heart rate variability is it's the amount of time that your heartbeat has in between beats. And you want this to be high, or because you want the high mark, because you want it more time in between each beat. Just like you want a lower resting heart rate, you want less time, or pardon me, more time in between the beats. And this is going to vary a lot with a lot of different reasons, but it's another marker that you can see as far as improvement. But also, if you have a Whoop strap, okay, it's going to give you like a readiness score. They're basing that off this HRV. And sleep's a big one that affects the HRV, or maybe you went through a stressful day the day before, or you worked out too hard for you, that may be too low. So a low score is going to be something you don't want, like the heart rate, resting heart rate, you want the low. You want this to be higher. Now, age is going to be a big dependent on this. So for example, and you guys can look this up, but say someone's in their 20s, they're probably, a good mark is going to be, a little higher, 60s, 70s, where if you go decade by decade, get somebody in the 50s and 60s, you're going to more look at like, 20s, 30s. Here's the big thing you need to worry about. Don't worry about, because you have a special consideration about what your marker is compared to someone else's. Just look at where it's at. Okay. Where's your baseline? Is it higher? Is it lower? If it's lower, maybe you're not recovering. All right. And, or maybe you're exercising too hard, or you maybe need to exercise. Okay. So HRV, heart rate variability. Make sure you remember that. And there's a lot of devices. Unfortunately, the Apple Watch does not do it. All right. So this is another one that is good while you're working out. So your heart rate recovery. Measure how fast your heart rate drops in the first 60 seconds of that rest period. As your conditioning improves, your heart rate should drop faster. So for example, your resting heart rate's 80, let's call it. And you're exercising, try to get up to your own zone 2. And let's just call it 120 beats a minute. In 60 seconds, we'd like to see at least a 20 beat drop, hopefully like a 30 beat drop or more. And so it's another marker that you can use to see how intense you should go or not go. Because if it's not dropping at least 20 beats in that minute, then maybe it went too hard for you. Because again, think about this, the recovery is just as important as the intense exercise. And so it'll give you another guide to see how hard you should go, or how not hard you should go. Because I know that with the many patients I've worked with, some of the patients I've worked with is, man, I just did something for 10 seconds. I'm just gassed. I'm just tired. Well, okay, maybe we need like a 3-minute break or 4-minute break in between. And one gauge we can do is if we have to break a little bit less as we go. And so that's another marker. So again, in review here, resting heart rate, you want that to be low. Heart rate recovery, as you see here, we want to try to recover faster, or it also shows us we went too hard. And then your heart rate variability. That's kind of, think of it as your readiness score, like the Whoop strap and like the Oura ring, and they call it the readiness score because it's a great indicator of many factors. Maybe you had a treatment the day before, so maybe that HRV is really low. Maybe it's a day you don't go as intense and you kind of back off a bit, things like that. All right, so we talked about the talk test. The talk test is actually, funny enough, out of these science equations, a lot of exercise physiologists and physicians out there say, the talk test actually works a little bit better than some of the equations. And I choose a Maffetone one because it's a really easy one. It's literally 180 minus your age. Okay. There are other factors that could be considered here: medications, different physical ailments, of course, ages, other things like sleep. But in general, 180 minus your age. So let's give the 40, 180 minus 50, so 130. So 130 is kind of that zone 2. Now, that may be too tough for some folks in the beginning. So I always put like a 10 to 20 buffer in there. So maybe if you don't have a lot of energy, you're not able to exercise that hard, and you're 50 years old, you're probably going to go 100, 110. That's, if you get it up there, that's pretty good. But in general, this is a good equation to take a look at. I always want to touch on other things in exercise, because they will go back to your cardiovascular health. Not just the cardio part of fitness is going to help your cardiovascular health. So big one for yoga, it can improve the quality of sleep, fatigue, and depression, NPM patients. That's your recovery. I think the benefit of yoga really lies within the deep meditation and breathing. That's going to be a great way to control your heart rate. So, just like when you get stressed or, you're upset, you're trying to take deep breaths because you're trying to calm your nervous system, trying to, calm your lymphatic system. You're trying to bring your heart rate down. And so we'll do breathing exercises in between intense, bouts of exercise to teach our body to get rid of that CO2 and get more oxygen, get our heart rate to calm down. And so if you do an exercise and you're like, oh my gosh, it's too intense, my heart's just going crazy, think about yoga, the breathing, the meditation, and of course, obviously the movement, which is going to help blood flow and flexibility and so forth too. But I try to get people to do this breathing stuff, and I say, well, think of yoga breathing. All right, you want to be calm, you want to be, stay within your zone and your limits. There's so many ways to do good deep breathing exercises. You can probably find 5, 10, 20 good ones on the internet, but this is a real simple one. You simply just breathe in through the nose for 5, you hold it for a couple of seconds, and then exhale through the mouth. And I actually like to do about a 7 or 8 count, because I like to really empty the lungs of air as best you can. I mean, that's work in itself. Try doing that 10 times in a row. It's work. You're trying to bring the heart rate down, but you're going to get more efficient at your breathing when you're doing exercise. Because you'll see folks go too fast, or maybe they're just not properly breathing during exercise. That too much CO2 raises the heart rate, feels like you're going really intense. When in actuality, you're not really going intense, you're just not breathing well. And so if you're someone that's struggling with exercise, not a lot of energy, don't feel very well doing exercise, prep your workout with some good breathing, at least like 8 to 10 deep breaths, and kind of prepare that diaphragm, because it's a muscle just like a bicep, just like a quad, whatever, and do the breathing. If you're not able to exercise right now, just start right there. Start right there. Let's skip through this real quick. All right. So I didn't skip anything that was really big. It was kind of more talking points, fun stuff. One thing I did want to show you real quick is just, going back to some of the cellular health and the gut stuff, is if you're in the position to do something like that, getting a cell healthier, drinking lots of water, eating foods that are helpful for the gut, that will in turn really help your heart rate recovery, resting heart rate, things like that. So just something I wanted to mention. All right, well, Anne, man, I did pretty good. I got the half hour, so I didn't do too bad there.
Yes,
So,
it's great. And to the visitors at this webinar, Justin joins us pretty frequently throughout the year and can help people on their own. If you'd like, you can reach out to him or to me, and I can connect you with him. But also, cardiovascular health is extraordinarily important for MPN patients. And we do have videos on our website with Dr. Ellen Ritchie talking about this. She's done a lot of research, and subsequently Justin has as well. And so, if you have any questions, I didn't see anything come up. But if you do, send those to me. I can send them to Justin or send them directly to Justin. And I want to relate that tomorrow we will be having a caregiver webinar, and that will be for 1 hour from 12 to 1 tomorrow. So join us if you're able. And on February 29th is Rare Disease Day. So we will be recognizing that with another webinar with a MPN specialist. And the theme this year is health equity. And so we will be having a person join us who is a patient, but she's done extensive work in health equity issues and challenges, and she'll be joining us, but we will have a discussion as well with MPN patients who have encountered some inequities. And so join us for those. That'll be, so tomorrow's the caregiver event, and then February 29th, we'll recognize Rare Disease Day with a webinar. And thank you for joining us, Justin. Thank you so much, as always. You're a great help to our organization, and we appreciate you. And happy Valentine's Day.
all right, happy Valentine's Day. Thank you. Always a pleasure.
Okay. See you soon.
All right, see you soon. Thank you, everybody.